A patient today asked about utilizing Remeron or Mirtazepine for their insomnia. Remeron is a medication that's used in major depressive disorder and sometimes used also in other depressive disorders or anxiety disorders. It affects serotonin, so increases availability or affects serotonin, and also affects other neurotransmitters as well. This medication, particularly at lower doses, can be pretty sedating. And so it's something that if someone wants to utilize a medication that doesn't tend to have the abuse potential that your benzodiazepines have or your benzodiazepine derivatives have, for example, like ambien or zolpidem or lunesta or Ativan or clonazepam, those kinds of medications, then you may want to use or consider using Remeron or Mirtazepine. It's thought that at higher doses, so doses of 30 or 45 milligrams, for example, Remeron is more noradrenergic than serotonergic, and so that's why it may actually be more sedating at the lower doses than the higher doses. And this is something that actually I find is pretty important to talk to patients about, because sometimes when taking a sleep medication and people are not getting the effect that they want or that they expect, they'll assume that they need to take more medication. But with this medication, I might actually say, less may be a little bit more. So let's say that we start on a 15 milligram pill of Remeron or Mirtazepine, and they're having difficulty falling asleep still, but tolerating it well. I may say, hey, instead of going from 15 to 30 milligrams, let's go to 7.5 milligrams. And it's pretty amazing that sometimes patients will have a really positive response and improvement in their insomnia at the lower doses, or actually by decreasing the dose of this medication. Other side effects beyond sedation, which we're trying to get from this medication, would include dry eyes, dry mouth, constipation, upset stomach, allergic reactions to the medication, and even anaphylaxis can occur. And there could be more significant side effects like changes in the rhythm of your heart, particularly in overdose, seizures, and others. And so this obviously isn't a complete list of side effects, but Remeron or Mirtazepine is a medication that I'll often try to utilize for insomnia for patients, especially as I try to avoid medications like benzodiazepines and benzodiazepine derivatives that have more abuse potential. If you believe this video pertained to you in any way, please be sure to speak directly to a mental health or medical professional, as these videos are meant to be informative only and not medical advice.